This is Russ Ward for Pixels and Pills, and we're at the close of the social media conference in Philadelphia, and I'm with Frank Dolan. And Frank's actually going to talk about the primary things that came from the conference in the last 8 hours or so, and how it's worked out, and give us sort of his 60,000 feet, 30,000 feet, 10,000 feet view of it. How are you? Welcome.
Oh, thank you very much. I appreciate this interview, and the conference was great. By the way, I mean the Social Health On conference, I think the format and everything, we go to so many meetings, but to me this is one of the more important ones. If you're centered around the idea or even interested in the opportunities around social health, it's been a great gathering of folks, and a lot of great ideas were certainly discussed.
Very good. So, in the context of this plethora of information that's out there in the world about people's healthcare, their patient regulations, and then there's files, and then there's all these different types of entities that have got information. Tell us your take about what this is looking like based on what you've heard.
Sure. Well, I think if anyone's got an idea that could be solved through these various platforms and technologies for this social health initiative, we really dug into, what are we dealing with just from the start? So when you think about the platforms and the systems, I mean, gosh, right now we've got so many different systems. An example might be electronic medical records. Okay, so we're probably all patients at some point. But right now, if I'm a patient, my primary care doctor in Boston, it is neither easy nor seamless for those records about me to be shared with, say, a hospital in San Diego. Social media, if we've got great ideas to exchange, and you're on Facebook and Twitter, and I'm on Hello and Google+, our great ideas might not be able to connect very easily. So thinking about those disparate systems and how might we have to build either redundancies or maximize opportunities for sharing and exchange of information to really take place. No question, when it comes to that, really thinking through from the baseline opportunity what we need to do to be there for our audiences is critical. We can't just do old marketing techniques and broadcast things like maybe we thought about before. It's a real community involvement here for this info share, if you will.
So how do we engage the communities in this info share? What's your view of where this is going to go? What's the vision of bringing the people together with their information and then the sharing in between?
Sure. Well, I can only speak from my experience. So I come from about 15 years in biopharma, and so that's kind of my bias looking at this. But I see so many opportunities to engage different audiences, from consumers to caregivers to patients to providers to payers. But I think for the biopharma industry and device included, thinking through the fact that we're used to a certain level of control, say of our contribution. Well, the community, when you're engaging them, may contribute back. So the idea of old techniques of interruption marketing, social media in particular, is a volunteer exercise. So people will kind of raise their hand or walk with their feet out of that conversation that we might create. Also, it's very much a quality initiative as far as the information exchange and not quantity. So if you're talking about Twitter, it's not the number of tweets, it's not the number of fans, but it's the quality of the engagement of that exchange where everyone really benefits. But receiving information from a biopharma device point of view, we have to develop a level of comfort with the fact that the facts, the volume, the bias, the velocity of that conversation might not be in terms or frames that we've been most comfortable with historically. And maybe that's what's holding some of the organizations in the industry back from getting in the game.
So we're really looking for these industry entities to get into innovation in the space and help out the end consumer, the patient, in that context from a social point of view. Yeah. So what's next? What's the next step?
Yeah, so I don't think there's probably any easy solutions out there. There's lots of tools, there's lots of platforms, there's lots of techniques. I guess, my advice or recommendation to any peer would be, and this could be from a global opportunity standpoint for social health, is to kind of just get back to the fundamentals. And so not starting with like ROI squared, like return on investment and risk of investment, but maybe just getting back to, who, what, when, where, why, how can we best serve those customers at the times that they need us. And then all of these tools and systems and methods start to become very clear and obvious on what we might go ahead and put into our plan.
Well, this is fascinating, and I think, Frank, we understand that there's more in the conversation to be held, and there's certainly more innovation that needs to come in this space. So if people want to talk more about this, how might we be able to continue the conversation with you?
Yeah, sure. Probably the easiest way is via Twitter, because you can find me, you can find my information, my contact information. So it's Frank Dolan, and on Twitter it's at Pharma411. Easy as that.
At Pharma411.
Yes, sir.
Frank, thanks very much. We appreciate your time and contribution, and we look forward to hearing more.
Thank you so much. Appreciate it. Thanks.
You're welcome. Thank you.